More, we're joined by Dr. Amesh Adalja, senior scholar at the Johns Hopkins Center for Health Security. He's in Pittsburgh this morning. Doctor, good morning to you. Cases spiking enormously in some spots, including here in New York City. How concerned are you right now?
I am concerned as we move into this winter season with both Delta and Omicron together and this swath of the population that is not vaccinated, that we are going to see high-risk people get infected and then require hospitalization. And hospitals in many parts of the country are already struggling because there are so many Delta patients that are unvaccinated that are taking up beds. And this is going to add to it, and Omicron is going to probably speed that process that was inevitably going to occur along even faster. And it may be too much for some hospitals to handle.
A lot of people talking about they're canceling events. Parents talking about pulling kids out of school next week because of this huge uptick in some spots. Is that too much?
It all depends upon the context and situation. You have to realize that this virus isn't going anywhere, and I think all of us are going to get Omicron at some point in time because this is just such a highly transmissible virus, and it's going to establish itself in the human population. I think if you're in a situation where cases are so high that they're disruptive, that you can't actually convene some kind of meeting or convene school, that's one thing. But we do have tools. We're not completely helpless. We have testing, we have masks, we have vaccinations, we have monoclonal antibodies, and we're going to soon have antivirals. So I don't think that we have to kind of set back the clock to the beginning of the pandemic, but I think people have to be careful about the fact that this is going to be a disruptive force in the coming weeks.
Are we seeing these huge spikes because we have two variants out there?
The larger part of the spike is caused by Delta. Delta is still the dominant version of the virus that's out there, but Omicron is starting to cause spikes, at least regionally. So, for example, in New York City, we saw that the outbreak on Cornell University's campus. That's a lot to do with Omicron, but we still are kind of bathed in a lot of Delta. Eventually, it's going to be all Omicron, but it's right now Delta plus Omicron causing this major problem. And what's in the hospitals is primarily Delta right now.
Two things, Dr. Adalja. First, you just said that we'll see antivirals soon. Do we have a timeline on that?
Not completely. We know that Pfizer has submitted for emergency use authorization, and their antiviral is the more promising one when compared to the Merck version. And so this is something that the FDA needs to move expeditiously on because right now we could be using this antiviral. We've seen the data. It's safe and effective. I think it meets the criteria for an emergency use authorization. And that antiviral is something you take by mouth and has a 90% chance of keeping you out of the hospital, keeping you from dying. It's very, very path-breaking, and I think it's part of what we need in our toolbox as we face this new variant.
The other thing that I'm thinking, because this is the conversation we had here this morning, so many people are, when do we get to the point where we do start treating this like the flu? Because of things, as you mentioned, like the antivirals, but also because many are vaccinated right now and boosted.
To me, that transition occurs when we're not worried about hospital capacity. And I think in many parts of the country, we have successfully kind of decoupled cases from hospitalizations in a way that we hadn't in the past. But there are many parts of the country where there are too many unvaccinated individuals, those with high-risk conditions, where a hospital has to worry about capacity on a day-to-day basis. To me, that's the transition point, and I think we'll get there, and we will get there during 2022. And the antiviral is part of that, but it's going to be kind of a patchwork of where we get there because the way the unvaccinated are distributed around the country puts a lot of hospitals, basically holds them hostage because they could get hit hard with a wave and then that lead to hospitalizations.
Doctor, I heard one well-regarded expert yesterday say because Omicron is so transmissible that the surge or the level of concern with Omicron is going to last a matter of weeks, whereas Delta was months. Is that right?
It's hard to know that. So when you look at the data from South Africa, which was the first country to get hit hard by the Omicron variant, they've already seen cases fall. So there may be something unique about the epidemiology. With Delta, it was 2 week. We saw these 2-month surges where maybe 20% of the people that were susceptible got infected all of a sudden, and then there was no one new to infect because people changed their behavior. That may not be the same. This may be quicker. This may be longer. I think we still don't have enough data to be able to say for sure. But we know one thing we know for sure is that it is coming.
Dr. Adalja, always still so many what-ifs out there, but we appreciate the insight. Thank you.